Good afternoon, Dr. Krell. I want to welcome everyone and all those who have concerns, questions, and issues that we want to be able to ask you, because you are our champion here in Idaho. You are on the front line on a daily basis, and we just want to first thank you for your time, for being with us and sharing all of your knowledge and intellectual thought that will help us continue moving forward, and especially give us an understanding as to what we as Idahoans can do to be a part of the process or be supportive. And as you've said before, social distancing and self-isolating is one of the best ways that we can be helpful. But we want to get down to some of these questions that people have. And if there's even additional suggestions that you want to make here, we're all open to that. One of the questions that many people ask these days is, why are people getting so sick with this particular virus, and what makes it so deadly?
We have to remember that this is a different virus than influenza. And we see millions of cases worldwide and hundreds of thousands a year of influenza. One of the differences is that the infectivity of this virus exceeds that of influenza. The way we express that is a number called a rho naught. That is, for everybody who's infected, how many people do they in turn affect? And for influenza, it's about 1.3. So if you have influenza, you're likely to infect one more person. However, this virus is more infective. And so we see that it has a rho of somewhere at about 2 to 2.5. So that we do see more community spread, which is what we're predominantly seeing now. We're pretty much past the travel cases. But for everybody who gets infected and isn't isolating, they're going to infect 2 to 2.5 individuals out there in the community. In addition, this has a much higher mortality rate than influenza. The mortality rate for influenza is probably about 0.1%. And while we're still working out what the mortality rate is for COVID-19, or as the virus is called, SARS-CoV-2, it is probably in the neighborhood of somewhere between about 1 to 2%. So that's at least a tenfold mortality compared to influenza. In addition, this virus, although influenza also differentially affects patients with comorbidities, that is, with other diseases, this virus does it much more. So patients who are vulnerable in the community are going to get sicker. It looks like about 20% of people, 15 to 20%, get severe disease from COVID-19. And of those, about 6 to 8% end up with severe disease, requiring hospitalization and ICU care. And that's our concern about our limited number of ventilators and PPEs and staff to take care of those patients, because this disease is both more infective than influenza and makes patients sicker, has a higher mortality rate. And why mortality is not limited just to people with comorbidities, that is the group that has the highest death rate from this disease. So it's critically essential that people who are vulnerable, patients with other diseases, be it hypertension or diabetes or coronary disease, those are the people who most need to avoid contact and socially isolate.
We're now nearing the end of the flu season, and we're getting in the beginning of the allergy season. What are some of the symptoms for those of us who haven't seen anyone affected yet, or may not have experienced anyone in our close circle having been affected? What do you think Idahoans should look for if they think that they have COVID-19?
The most prominent symptoms are respiratory, generally starting with cough, often progressing to shortness of breath, sometimes chest pain, headache, muscle aching, sometimes diarrhea or abdominal symptoms. You've all heard about loss of smell. But the major things to watch for are the fever and the respiratory symptoms. But it's important to remember that patients sick enough to present to the hospital, probably 80% of the time will have a fever. But people who are only mildly symptomatic very often do not have fever, only about 50%. So it's important to pay attention to those other symptoms and to self-isolate if you have any of those symptoms. Unfortunately, in the state of Idaho, until we get better testing, we are not able to test everyone with symptoms. And so the importance of quarantining if you have symptoms is critically important.
Yeah, which has been really scary and frustrating for some people because they are wondering what does it mean to be asymptomatic but still infected? And they're wondering, how will we get on top of this virus if people are still spreading it without even knowing they have it yet?
All we have is this blunt club right now of separating from each other, of masking when we go out, of being very OCD about hand washing. And that's what's going to flatten this curve at this point. Until we get to the point where we have universal testing and we can identify who are infected in the community and really work at a targeted program of isolation. And unfortunately, in the state of Idaho, we are weeks away from that. But the resources for testing, other than the state lab, are going elsewhere. The commercial labs are still taking 5 to 10 days to get tests back. We're able to get tests from the state now in 24 to 48 hours, which is being very helpful. But we don't have the capacity for widespread testing, which is the next step in this war that will allow us to get control.
Yes. That's great, and thank you. And I think that too, when a lot of people here, we've been talking about isolation and keeping our distance the best we can, trying to be cautious and worry for not just ourselves but for others, so we're not passing along the virus. Since the governor has declared the stay-at-home order, many of us who are like myself, who live out in rural Idaho in the countryside, a lot of people in Idaho are here because they're very outdoorsy by nature. And so these folks, I can imagine, find it to be very difficult to just be stuck in their home or to not go outdoors. But for those who do want to go outside to go for a hike or enjoy nature, how can we safely spend our time outside? And do you recommend us to wear masks when we're outside?
I do. I think the guidance from the CDC that, as you know, changed this weekend it is helpful. Now that we understand that the virus can be spread just by speaking, it can be aerosolized, probably for short distances, unlike droplets, which are larger and can spread over about 6 feet. So that's the importance of the 6-foot rule, if you will, and of wearing masks when we're out so that we don't spread the virus in that short distance of aerosolization by speaking. It doesn't mean we can't go out. I think that we need to make sure we're doing social distancing when we go out and get some exercise, that we not go to crowded areas. I would avoid trailheads where there are a number of people gathered, but getting out, taking walks, taking hikes. For me, I go out and check my cows and see how they're doing and take care of the livestock. Those things are important in maintaining our sanity, and if we're careful, we can do it safely.
Yes, exactly. We're doing our best as well. We go for hikes here and there, but very rarely these days. But we do try to get that outside fresh air, and it's so important, especially to connect with nature.
It is.
One other big question I really want to ask you before we shift lanes here is, there are a lot of myths or misinformation that's being passed around out in the social media networks and or wherever people are getting their information, their sources. And I want to ask you, what do you believe are the biggest myths about this COVID-19 virus that you'd like to clear up for the people?
I think one of them is what you asked about, that young people don't get the disease and don't spread it. And it's so important to understand that, in fact, young, healthy people are a major source of spread when they're asymptomatic or minimally symptomatic. Um, the other thing that we're starting to understand is that the inoculum is important, and that is that it's the amount of virus that you get exposed to. So that repeated exposure appears to be more dangerous and portends more serious illness than if you are just minimally exposed. And that's one of the things we can do with the social distancing and the masking and being compulsive about hand washing. I know there are lots of internet sites that would claim we're all overdoing this, that it's not a big deal. It is a very big deal. And if we're lucky, we're going to limit this to 100 to 200,000 lives lost in this country. If we don't pay attention, however, that number could be up over 1 million. And this next few weeks are the most important time for the nation and for Idaho, particularly for us. We've got to be in this for the long haul, that we are still at least a couple of weeks, according to modeling that's been done by University of Washington, that our peak's going to come about May 1st. So we can't let down our vigilance for some time yet. We'll get past this. We'll all get back to normal lives, but it's going to take time. And I do worry about the economic impact on people, particularly people in service industries, lower wage workers who don't have the kind of safety nets that many of us do, and the importance then of taking advantage of the federal programs that are out there so you can continue to feed your family and allow you to stay at home and prevent spread and flatten that curve.
Yes, exactly. And I completely agree. And, I was thinking about all these other issues that are on people's minds, aside from the big one, which is the financial economic crisis that we're in, and many of the hardships that our families are facing, having to leave their jobs and worrying about where they're going to get their next paycheck. And of course, we have our relatives and people that we know who are in the prison system who are being affected by this disease. And then we have those folks who are homeless and on our streets. And, how are we going to help them? And so there's a lot of concerns that we all have and trying to figure out a way to best do our part. But I do know that there's another big issue that many people are not talking about. And it is Idaho's already dire suicide problem, which I hear is getting much worse. Because we have a lot of folks who, according to the latest numbers from the Idaho Department of Health and Welfare, have said that the state has its worst rate of suicide deaths in 2018. And so now I'm starting to think and understand about, what it is like for many of those who are experiencing depression or any of these mental health concerns that they have, these issues that they're experiencing. And if I were one of these folks who in Idaho am feeling really lonely and isolated, as many folks are at this moment, I would like to take the time to visit, one or two of my friends. What would you say is, if there is a way that I can do that safely, and if not now, when would you suggest holding that time to?
There is a way that we can do that safely now. I think it's important for all of us to have that perspective that Idaho has a terrible suicide rate, that our, as we've called them, deaths of despair are way too high in this state, that we have not had the kind of social safety net, the kind of behavioral health resources that we need. It is better at this point. And at least in Eastern Idaho, which I'm most familiar with, we do have programs, and that help is out there, both through the state's behavioral center, through the hospital's behavioral health center, and that we are doing video chat, telemedicine visits with patients, and that can be very supportive. and that for anybody who feels that they're on their last legs, that they are a risk to themselves, getting in touch with the suicide hotline is very important. And to reach out to those community services that are out there. They haven't disappeared. We're doing them in a different format, but my psychiatric and behavioral health colleagues are working very hard. This makes it a more stressful time since we're having to isolate and we don't have that social contact that is so vitally important to all of us maintaining our mental health. So we've got to learn to reach out in other ways. I will say also worry about people in abusive relationships, that we are now cornered, if you will, because of social isolation, and that there is help out there for people in abusive relationships. This is not a time to say that there's nothing I can do and I just have to endure it. That's not the case, and help is out there.
So with that, I wanted to get to one more question before we reach out to our social media network and friends there who have questions directly for you. I want to get your perspective on how we can help. We have a lot of folks who have volunteered for our campaign and this movement, and they have said to us that they want to be able to help not only people in their communities, such as their neighbors, but they also want to be able to help our medical community who are on the front lines saving lives and risking their own lives in the process. So how can I help from home?
First and most important is, of course, that social distancing and the isolation to keep our healthcare workers safe. I had a column in the paper today that it's a time to stay home and make 2 masks, one for yourself and one to give to an essential worker. We need at this point to be supportive of our EMS system and our police and fire forces out there, to other essential workers who are providing us with groceries, who are driving trucks to get items delivered, and that this is a time we can be supportive of them by community masks. And that's one thing that I would encourage people to do. The other is to be a community, to understand if you have neighbors who are isolated and don't have the ability to get out, to be able to help them, getting them food, making their trips to the pharmacy, which all have curbside pickups, and you can keep yourself safe. But this is a time for us to be a community.
We all want to be responsible and accountable people, especially those of us in the rural community, because many still find that this is not real. And again, by finding misinformation elsewhere. And that being said, there are a lot of folks still in rural Idaho who I hear asking questions about, their neighbors. And they say, what do we say to those folks out there who are our neighbors in rural Idaho who think this is mostly a, quote, big city disease, and therefore don't have to think twice about it?
I think if you just look at the demographics in the state, although we've had very limited testing, if you look at the demographics of where cases are coming from, they aren't all coming from the large cities. And there was enough travel early on between urban areas and rural areas that we're going to see cases in those rural areas, and we are seeing cases. We're seeing cases from Jefferson County, from Fremont County, from relatively rural areas. You are not immune to this just because you're from a rural area. So we need to take the same precautions there as we do in urban areas. And remember that our healthcare resources are much more limited in our rural areas in terms of strain on the system. So I would advise those of us that live in rural areas, we've got to be as vigilant as if we were in an urban area.
So with that said, Dr. Krell, I want to thank you for all the great advice that you've given us thus far. This is a lot of good information that I think people can take and be comfortable with. And if they have other questions or concerns, I'm sure he'll back and we'll follow up with you. But you really covered a lot here. And I just want to thank you so much for your diligence and your dedication to Idaho. And of course, your public service in this regard, because you are truly a hero to many of us. And we cannot thank you enough.